And it's an issue on mom and dad's minds as they begin to return back to work, and that is who will safely be able to take care of the kids. Well, thousands of child care centers still haven't reopened and are also at risk of going broke. Scripps reporter Amanda Brandeis right now is showing us how some groups are working to fill the gaps and what experts say is the long-term solution for families.
Daycares trying to serve their families face an uphill battle.
A lot of childcare providers can't afford to go a few weeks or a few months without revenue, and they certainly can't afford to operate with fewer children and less revenue.
Add into the mix higher expenses for sanitation and personal protective equipment. Katie Ham wants to see the government make investments into early childhood programs.
Childcare was in crisis before the pandemic. I think it was more of a quiet crisis, and now it's front and center for a lot of Americans.
She says many programs were barely making ends meet before the pandemic, and that half of Americans live in childcare deserts, neighborhoods where there's simply too few childcare options.
We work long hours and they can be unpredictable, and being able to have safe, adequate, affordable childcare was just not an option.
As Dr. Julie Chellaby responded to the COVID-19 crisis in the hospital, she faced another one at home.
When I got the call that there was a person who had stepped up to provide this volunteer childcare, I almost cried.
I had a lot more free time on my hands.
Charlie's Dang volunteers for COVID Childcare, an organization created to connect medical workers with free childcare from volunteers.
You know, we knew right away, just talking to Charlize, our volunteer, that she was going to be great and the children loved her.
A lot of hospitals have furloughed up to 70% of their staff in some cases. It's really important that once these medical workers come back to work and childcare facilities are still often closed and they're still not socially distanced, that they have an alternative.
Stanford University student Ryan Sislakowski founded the organization, with branches now in Southern California, Seattle, and Reno. Another solution, the YMCA also stepped up to provide childcare for essential workers. Its goal is to eventually help the general public as more Ys begin to reopen nationwide. But advocates say the best solution as parents get back to work will require a lot of help from the government.
The childcare community has asked for an investment of $50 billion to stabilize childcare. That is on par with what other industries have asked for.
But Ham says the industry needs a long-term investment to not only help parents afford childcare, but ensure workers earn a livable wage.
So that next time there is an emergency or a crisis, we have a childcare system that can serve everyone well,
rather than a broken system trying to survive. In San Diego, I'm Amanda Brandeis reporting.